COVID-19 has reached the remote Elcho Island off the East Arnhem coast. 19 cases were recorded in the Indigenous community of Gallowinku, all of them currently isolating on the island.
This is a very isolated part of the Northern Territory, so we have many people there with complex needs, and for this reason we will be moving to a 7-day lockdown.
Yirrkala has also entered a 3-day lockdown after 2 new cases and COVID-19 detected in the wastewater. Authorities sending more resources to deal with the outbreak. In both communities, the lockdowns apply to everyone, vaccinated or not, with residents only allowed to leave their homes for 4 essential reasons.
This is all very new to especially the remote settings. Watching it on news and watching what's happened all over the world, and now like a reality of it happening in our own communities.
There are now 39 patients in NT hospitals with COVID-19. 25 people are receiving acute care. 1 is in intensive care in Alice Springs. 284 cases were recorded until 8 p.m. last night, bringing the total number of active infections to almost 4,000. More than half of the active cases are in the Greater Darwin area. There were 7 new cases in the remote Central Australian community Yuendamu and 6 cases in nearby Yullamu, bringing that cluster to 72 active infections. Lockout orders remain in place for Yuendamu, Yullamu, Alice Springs and Amungana until Sunday, with new cases recorded in high-risk outbreaks at town camps, the correctional facility, an aged care home and a renal hostel for dialysis patients. The government says it will send COVID-19 positive patients to the top end when needed to relieve stress on the Alice Springs Hospital and the Todd facility.
We know people from Central Australia would ideally prefer to stay in Alice Springs and a bit closer to their country and to their connections, but in some instances we may need to move people up to Howard Springs to the Centre for National Resilience.
Health authorities say cases in the Territory are predominantly the Omicron variant, and the slight drop in today's numbers offers the chance to review plans for living with COVID-19.
COVID care or COVID in the home that can be done safely in urban centres, regional and also in remote locations.
The government says lockdowns and lockouts won't eliminate the virus, but will hopefully slow the spread. Saskia Mabin, ABC News, Alice Springs.